Hi everybody, thanks for joining us again. Now we're going to go straight into active passive range of motion and strength testing of the knee. This is video 2 of 5 of our AFP video series on the examination of the knee. So first, what I'm going to have my model do here is I'm going to have her flex her leg, flex her knee as much as she can. So go ahead and flex. Good, and go ahead and relax and go into full extension for me. Great. What I like to do after I have my patient actively flex her knee to her fullest capability, I like to compare it to the contralateral side. So go ahead and do the same thing on the other side for me, please. Great, and go ahead into full extension for me. Go ahead and back down. Wonderful. So what I'm looking at here is I'm looking that both sides are comparable. The other thing that I will do, I'll stick my hand underneath the patient's knee and I will say, push my hand down into the table as much as you can. So I have them maximally contract their quadriceps, and what they're doing is they're getting as much of the extension of their knee as possible. So go ahead and relax. And I do the same thing on the opposite side. Go ahead. Good. Go ahead and relax. Now, if you have a patient who is unable to fully, actively go through flexion and extension of the knee, what I do is I bring them through that range of motion myself. So I'll bring that patient back into as much flexion as possible, and then bring them down into extension. Same with the contralateral side. And this is our passive range of motion. Strength testing. We're going to go straight into this. What I like to do first is I like to do a straight leg test, and what this is testing is this is testing the quadriceps muscle. Go ahead and lift this leg straight up in the air for me, please. Hold that right there. Don't let me push down. When I do my strength testing, I hold my force for about 3 seconds. Go ahead and relax. Always compare to the contralateral side. So bring this leg straight up for me, please. Hold that. Good, and go ahead and relax. And the next thing I do is specifically knee flexion and extension strength testing. So I'm going to bring our patient up right here, and I'm going to stabilize her knee with my one hand. My other hand's going to be right here, down on her tibia, and I'm going to have her try to kick her leg out as much as possible. Go ahead. Good, and again, I'm holding this for approximately 3 seconds. I'm going to do the same on the contralateral side. I'm going to bend her up. Good. Push me out. Good. Go ahead and relax. Now, for testing flexion of the knee, what I'm going to ask my patient to do is to roll over on her stomach, so lay prone. So go ahead and turn over for me, please. Good. This is one of the best positions in which to test this strength. So I'm going to bend her up to about 90 degrees. Now resist me. Don't let me pull down. I'm going to pull down on you. Don't. There you go. Good. Again, I hold for about 3 seconds. Go ahead and relax. And then you compare it to the other side. Hold right there. Don't let me pull down. Good. Go ahead and relax. And this concludes our assessment of the active passive range of motion and strength of the knee.